Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have with me Miss Nancy Andino. Hey, Nancy.
Hi, how are you today?
I am great. So excited to see you today and talk with you about mental health.
Mm-hmm.
But before we do, I want to go ahead and just read a short bio so people can kind of know who you are.
Okay.
So, Nancy Andino is a highly experienced licensed clinical social worker with over 23 years in the mental health field. She was raised in the island of Puerto Rico and Brooklyn, New York, by a powerhouse Puerto Rican mom that nurtured her voice, curiosity, and taught her to honor her yes and her no's with confidence and no reservations about laughing out loud. She is the founder of Tailor for Change, LLC, a bilingual private practice that was formed in response to the disappointments with the present mental health system. She offers a range of services, including psychotherapy, groups, internships, clinical supervision, wellness retreats, consulting, and training services. Nancy's approach is cultural humility and awareness with a focus on serving diverse communities. I'm going to stop there because I'm going to have you tell your story. So, Miss Nancy, tell us your story because I know you have an interesting one.
I'm trying to figure out, do I start from my time in Puerto Rico or when we got here? But either way is I was brought into this world with a lot of love from my parents. My mom chose me with the moon, said I am gonna have a little girl. So she said that she aligned herself with the moon spirits. And decided like I am going to bring her in, and I was brought in with a lot of love and affection. And I come from my family, the majority of them are still in Puerto Rico. And one of the things that as time went on, we came back to the United States because I started cooking in Puerto Rico, was done in the United States, and then they took me back to Puerto Rico. So there's still home to me, and my family is still there. There's a few of us here in the United States. And when we got here, we moved a lot in the beginning, but then we settled in Brooklyn. And that's where my journey started with what I was witnessing in the community. I grew up in Fort Greene, Brooklyn, where it's the public housing. And there being in that community and being able to witness things that as a child you should not be witnessing, right? In those neighborhoods and kind of assimilating to what was happening around me, but coming home, and at home I was coming into Puerto Rico with the culture, the food, the music, and the Spanish. And I always went when I experienced my education experience in Brooklyn was very interesting, I would say, looking back at it, because it was all public school system. And you once again see a lot of things that you should not be seeing. In junior high school, a close friend of mine shows me, hey, this is what I brought to school. And he had brought a weapon to school. And that was in junior high school, right? High school, it was a easier, more palatable experience. And then I decided to go away to school. And during that, I was 17 when I went away to school. It was maybe about 2 hours away. And that was pretty cool, interesting, shocking. And that's where I got to experience. Maybe there was less than 5% of the population were people that looked like me. Everybody else was white.
Oh.
And, and so that was very like, okay, this is an introduction. And that's actually been, I'm sorry, you may hear my doggy. His name is Choco. Um, and that was the introduction to my professional career, education, up to now, postgraduate education, mainly being in all white spaces. One of the things that motivated me to become a mental health professional was what I witnessed with my family, but in the community and in the places that I was employed in as once I graduated from undergrad. My family members, mainly the men, had a lot of, I would say, a lot of trauma experiences, and my witnessing their experience allowed me to be able to respond in many different ways, where a lot of my defenses became stronger. The way I communicated shifted and changed as to how I engage in my relationships, not only romantic, but with friends and stuff like that. And to this day, I still remember I was like 15 years old, and my aunt asked me, well, what do you want to do? And I clearly told her, I want to be a psychotherapist. And I want to be able to work with people who are in addiction and who have mental illness and who need support and just need guidance. And their faces were like, what? During that time, I didn't know what a psychotherapist was. It was like, I'm going to be a counselor for this and this. I didn't know what that was. I didn't know anybody that did that. And that's where I'm at right now. I have work from people who are survivors of domestic violence. I am an addictions counselor. I am a Gestalt therapist. I am a EMDR trauma therapist. I'm a Reiki practitioner. So I've been able to start marrying these modalities that allow me to be as present as possible with my clients now. Like the clients that I work with all look like me. I would say 98% of them look like me, and some of them had never experienced participating in therapy. Others had very challenging therapeutic experiences, and that's how they ended up coming to me. The continuing motivator for me to do this has been the major disappointments, as we had discussed, like the major disappointments that I've had with the mental health field, with mental health services, and particularly in the places that I worked in. And that was a catalyst for me to continue to learn more and experiment and be more curious, because witnessing patients and clients coming to receive services and them not receiving quality services was very heartbreaking. Particularly when they're receiving services from people that look like them. Like, that made no sense to me. So that's what kept me in the field and wanting to learn more. What can I apply? How do I apply what I'm learning from a patriarchal lens, right? Because the majority of theories that are in mental health are men, white men. And how do I utilize what I've learned in these spaces in very cultural, spiritual driven spaces with my clients? And I always say I add a little sazon, a little bit adobo, mixed it up, and this is what my clients get. And it's been very fulfilling. Very, very, and still is very fulfilling. And I'm still very curious with all my clients. I provide presentations to the community for free. During COVID, I started doing breathing workshops for free. Like, we all need to breathe, we all need to feel, because the commonality amongst us is emotions. Mm-hmm. No matter what we look like, we all experience emotions, right? Mm-hmm. And once I decided to leave the places that I was working at, I feel like I got to expand so much more. So much more. And my mom was a big part of that as well. Mm-hmm. One of the things that I was experiencing prior to starting my own practice was, how am I going to pay my bills? Right? How am I going to get clients? What is this going to look like? And I remember I was driving down the West Side Highway, going from my work to my postgraduate Gestalt training. And I'm just like, I got to get out of here somehow. I need to be able to offer this in a different platform. And I call my mom and I'm telling her in Spanish, like, how am I going to pay for this? What am I going to do? I really want to do this. and she tells me, ¿Y cómo come la gallina? Like, how do chickens eat? And I'm like, why are you bringing chickens into this? How do chickens have anything to do with this? She's like, well, tell me, how do chickens eat? I'm like, with their beak. And she's like, no, un grano a la vez. It's like one grain at a time. And that's how you will build your practice, one client at a time. As long as you continue to be compassionate and explore and be curious, your clients will know your heart. And I took that and run with it. And that's where we're at now, continuing to grow and continuing to learn and see how I can combine and marry everything that I learned so I can offer it to my clients in a way that they can digest it and it can be fitting for their beliefs, their norms, their faith, and also allow a space for them to be able to challenge their beliefs, challenge the norms, and challenge the faith in a way that can support them in how they want to be present.
Yeah, I love that.
I answer the question.
Yes, yes. So, so just going back to just the basic topic of mental health.
Yeah,
So, I believe in the last few years, people have become a lot more isolated. There's a lot more loneliness and depression, especially in the United States, maybe North America.
yeah,
Um, Yet, and a lot of people we were talking about, a lot of people are talking about mental health, but there's still some stigma around mental health because, like, I'm okay. I don't need a shrink. I don't need, I don't, I'm just fine.
yeah.
They think they're just fine. So, the question is there certain cultures where it's definitely not as accepted as others? Because, you're working with the Hispanic community. And you said you were trained by a lot of white guys. So is there certain cultures where it's like it's less accepted or it's like I don't want to say it's a weakness to get mental health help?
Yes. And it's not just a certain culture when if we pay attention to it is for like the global majority, whether it's India, China, Africa, the Caribbean, Central America, um, the culture seeking support from somebody else or speaking outside or bringing your problems and sharing them with a stranger what happens in this house stays in this house is very big,
Hmm.
right? And you're supposed to be a strong person, so why are you going to get support? Um, and the Latino community and then African American community is also there's although people are talking about it, there's still very a stigma about seeking and receiving the support because then it will be you are weak and it's not being they're not viewing as the your experience as a human, particularly in where how we living now and like you shared the loneliness being experienced, the way the impact social media has on people's self-worth, self-doubt, not being enough. um it's it the challenge for them to receive it and be able to digest what's happening or being able to communicate that during the sessions, it's big. They come and they don't know where to start from.
Hmm.
So it's literally we're assistant, right? I am assisting as to how you can begin to express your emotions.
Hmm.
What is it that you're actually feeling, not just what you're thinking, right? What you're thinking and all the information you're coming in here with hasn't helped you because we still haven't been able to make the changes. What is being experienced as a whole person?
Hmm.
Then that way we can become mindful of that. And then it allows us to be able to start making the changes and decisions that we need. But first, we need to get them to be vulnerable enough to experience their emotions with them first, and then vulnerable enough to be able to share it.
Hmm.
So it's from visualization work to sensations to memories, anything that we are able to bring in that allows them to share and one thing that you notice after several sessions, they're like, "Oh, how come I didn't do this before?" I said, well, because we've been trained not to speak outside the home. We've been trained not to say we feel sadness, right? We've been trained not to say, I'm not, I'm not feeling as motivated. We live in a capitalist society, which is produce, 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 produce. So it's not enough is the trend, right? That's the standard. No matter what you do, it's not enough because you got to do more.
Mhm.
And you're coming to a therapist, that means you got to take time out of your produce, produce, produce to go talk about your problems. What? That's that's frowned upon. And it's also a privilege to seek mental health services. Not everybody can afford it. Not everybody has health insurance. And the people that have health insurance, sometimes they have a very high deductible. So the stigma connected to it, along with availability for it, along with finding a therapist that you can connect with culturally,
Mhm.
right? That can see you and speak your language and speak, not only speak your language, but also speak your language.
Mhm.
There's a difference in that, right? And that is able to connect with you. That's a challenge.
Mhm.
And there's a lot of barriers to it, no matter what part of the country we're in.
Mhm. Yeah, that's true. And when you left your place of work where you were working somewhere else and you said, "Okay, I'm going to open my own practice." What were some of the issues you saw with the place you were working before, as far as availability, as far as the kind of care people were getting, and what
Yeah.
was your vision that you
So
wanted?
it was in hospital settings, it was in community health centers, it was in mental health centers, and I'm not sure how it is where in the state you're at, but when you're meeting with somebody, it is one after the other, clients one after the other, 10 minutes, 15 minutes, that's it, right? And if somebody has an additional question or they're not um, taking their medications the way they've been told to take them, is that you're non-compliant. So we start with this. You're not doing what you're supposed to be doing, right? I told you to do X, Y, and Z, right? Not really paying attention to what are the other things that are taking place in this client's life that they're not able to, because we're making an assumption that they'll know they have a place where they're going to put their medication. We're making an assumption that they'll be able to remember to take the medication the way you may have told them to take it, but there's a breakdown in the language that how that information was provided to the client. And if the client is coming into the office and they're anxious and nervous about meeting with the doctor because there's all these things that's been happening to them, and the doctor tells them, well, what's happening? Like, oh, everything's fine, right? Because you can't tell the doctor there's something wrong, because then they're gonna think there's something wrong with you. It's like there's a disconnect, right? You're coming to the doctor to receive support. But then when the doctor walks into the office, into your room, and their face is, they
Mhm.
have a face already, it's like, already now I got to protect myself from what I was being experienced. When the doctor doesn't look like you, and it is the belief of just another one coming in.
Mhm.
I have more clients to see what is it when the doctor is not looking at you and they're just going, answering the questions, asking you questions and just plugging in the answers, or you're sharing with them and they're typing as you're talking,
Mhm.
right? When the people that are at the front desk and you're coming in to receive support and they have an attitude, they're complaining, they're giving you an attitude,
Mhm.
or treating you as this is a favor that I'm doing for you. When you're being shamed, especially in addictions, I worked in addictions for a really long time. You're here again?
Oh.
If that's the how you're being received. Like, what are you here for? And why are you here? You know last time what happened. I can't be doing all this work for you and blah, 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 blah. That's already the person is coming because they're seeking help. And if the place they're going to receive help is shaming them and judging them for coming in to receive help, And then they look like you. They may look like your aunt, your mom, your cousin, and they're doing this and talking to you in a tone of voice that has no compassion or empathy, then I'm not coming back.
All of
Uh,
that, what you just described, sounds horrible.
but
I,
it's
it's actually almost worse than
in
not getting care. It's going in and having something else to feel bad about.
yes, the what actually the thing that I couldn't take anymore, like I say that the stick that broke the camel's back or whatever,
Mhm.
um, was I was at a conference and this was when K2 became a very big thing in the city and nurses were being attacked. We didn't know what was happening with patients because they was just having such adverse responses. It's something that we had not experienced before. And I was running a medical unit, and there was some concerns in regarding the connection between the emergency department and the unit I was running. And we already, we have regulatory bodies that we have to documentation. Everybody hates the documentation, but gotta document, gotta make sure that things are in order, the medications and all this type of stuff before the client can come to the unit. Those are also barriers to care, right? Because the doctor is already inundated with a lot of work. Then you have a patient that is coming in and they're under the influence or they're going through withdrawals. And they got to do all this paperwork to try to get them to the unit. So doctors will decide they're not going to do the paperwork, just sit and wait. If I have clients who are starting to go through withdrawals from alcohol, that's extremely dangerous. They can die. Clients who are going through withdrawals from opioids, right? Or mainly those two. Because for crack cocaine, okay. But when we're talking about opioids and alcohol, it can be very severe withdrawal symptoms, and you have them just sit and wait until that unit, the person that the assessments will be done by that unit until they get here. When I brought this as a concern, the chief told me, you know what, you care too much. That
That's
was
amazing that someone would say that in healthcare. Most people go into healthcare because they care about people.
yeah. I was like, what? And I had just found out information as to what was the barrier to the doctors to be able to refer the clients, to just transfer the clients from one unit to the next unit. And it had came from another doctor. It was like, Nancy, you're director for this unit, right? Like, yeah, this is what's happening. And I'm the only one that's sending the clients. And patients are just laying there waiting. So by the time they will get to the unit, it was so angry and so much pain and it's just going through some, you see people in their most rawest moments, right? And what I wanted to see them receive was some compassion, and you don't really see that. And addiction is a reason for it. There's a reason why a person is numbing.
Mhm.
There's a reason why people overeat, overdrink, use drugs, shop, get obsessed with things. It doesn't just come out of nowhere. There's a reason for it. And I feel like as a mental health professional or a healthcare provider, we should be curious as to like, well, what's happening? That way we can get to the root of the problem because what we're seeing is just the symptoms coming at us. So when I was told that, I was like, I'm done.
Mhm.
And that's when the call happened. I called my mom. I was like, this has to stop. I got to get the heck out of here because I'm like swimming against the tide. It's not working.
Mhm.
So that really stands out. And to this day, that's what I still see. And that motivates me to want to share and be as present as possible and as compassionate as possible with my clients and be able to share information. And with people that don't know anything about it, like, well, do you know? Like, well, whenever they're going to judge somebody, like, oh, well, you really don't know what the story is behind it. There's always something, right? Because that just continues the stigma when we have no curiosity or the desire to know what led to that.
Yeah.
But that was the determining factor, being told that I care too much by a chief of this is what we're supposed to do. What do you mean I care too much?
Yeah. So when you started your practice, how did you get your first clients?
Um, I first it was finding an office, getting an office. And I go, I can't just, how am I going to pay for office space? And I went online on Psychology Today and I started looking to see who in the area that I want to open up my practice in. And I reached out to several therapists who were also Spanish speakers, and one of them responded. And she was like, yes, I'll be willing to share office space. I could sublease from her. So I subleased from her, and I had some clients because I was doing postgraduate training as to become a Gestalt therapist. So I already had some clients within the program. So I was like, okay, I'll have a couple of clients that can come and see me there. And then the word got out. We have a Spanish speaker. She is young. She is personable. Go see her. And that's how it started. Literally one client at a time, a cousin, a wife, an aunt, a mom, like, oh, a colleague. I found out about you because my colleague was talking about her therapist, and like, well, I should go see one. So that's how it started. So then I had to cut down. But yeah, that's how I started.
Nice. And now
And I
you
don't think I'm gonna look back.
well, when you said, you have like 10 minutes or something with someone, how can you possibly do anything with someone in
Really can't
10
do it.
minutes?
Yeah. And it's being run, it's run that way because the insurance companies don't pay enough. There's a whole system that is set up like against healthcare, right? Being able to provide quality healthcare. And it starts off from, the laws, then we get into the insurance companies, the pharmaceutical companies, and then us and what is the client. So if you take too long with a client, then you don't really get reimbursed. You don't get reimbursed what you need, then how are they going to pay salary? So it's like a trickle down effect. As a therapist in my own practice, I get to take my time with my client.
Mhm.
Or we get to get to the core. So we provide services to less people, but at least it's as impactful as possible because then it spreads. So if I'm providing therapy to one person in this family, by the third month, the entire family knows, hey, you can do this and you can do that. Because I make it a point to show my clients, we need to identify some supports in your life. Because if we're going to be working towards making you feel better and becoming clearer on how you communicate, be able to share your emotions clearer, be able to set boundaries, this is going to impact your family relationships. And they need to know that you're participating in this and what some of the goals are and some of the changes they'll be seeing. Because therapy has side effects. It can bring a family together and relationships together, or it can literally separate them because of the changes that take place if you're actively practicing what we're discussing in our sessions. So once they're able to identify those people, and I ask, who have you identified? Then from there, it begins to spread in the household, right? And then family members will be like, I want to meet Nancy because I got to tell her what has been happening. You start having, you start
They want
having
their turn.
yeah. So, and then at one point I have forgotten that I was, my master's program, I did my focus in group therapy. So, you start a practice, a business, and some of the things you forget that you were offering to other organizations, you forget, hold up, I can utilize that for me
Mhm.
and still offer that. So then I started doing groups, and in groups, it allows you to, provide services to more people. And then they get to share it. And even if they're not my client as an individual client, they're participating in the group, so they're getting their information.
Mhm.
And then from groups, I was like, I can do retreats. So
Mhm.
I started doing retreats a couple of years ago. And there you get to expand it a little bit further. And then clients started asking, are you going to be recording this? I can't make it to the group. Can you record the group? I'm like, no, it's confidential.
Mhm.
But I started identifying certain topics And with those topics, I was like, oh, I can offer virtual classes. It's kind of like, it's been organically doing that.
Mm-hmm.
And so clients are able to go for that's recently started. I actually decided, oh, what I'm offering to the community, I can record it. And those people who were not able to participate, they can still be able to participate during their own time. So they're able to go on the website, look at the recordings, do the exercises and all that stuff on their own time. And then it kind of continue with building curriculums for other organizations. So why not build my curriculums for my groups? That's what I do, is organically taking place. And then that's how I ended up writing a workbook.
Well, tell me about the
curriculum.
workbook. Excuse me. Oh, tell me about the workbook.
The workbook is the Pillars of Trust, and it's a workbook focused on people building their self-trust. Because if you really can't trust yourself, how can you be vulnerable? How can you engage in relationships? How can you be curious? How can you be self-compassionate? Right? How can you be able to have clear boundaries and be able to honor them? How can you honor your values? And that came from a group that I started on trust. And then I did like a Pillars of Trust retreat. And then it became a common theme during sessions that if clients are not able to engage properly in their relationships and then professional, like, yes, I trust myself. Okay, everybody says that. And then like, well, what do you trust yourself in? When you're not getting an answer back, it's kind of like, does your body trust you to take care of it? Because you've been pounding it, right? And with the, I need to do more, I need to do more, I need to do more. And whatever I do is not enough. Does your body trust you to take care of it? Because your mind is saying, I got this, yes. And your body's like, I'm exhausted. I need to go use the bathroom. I need to get water. I need to move. And you're like, just a little bit longer, pushing and pushing. Do we really trust ourselves? And that's how I got to a very practical layman's terms workbook.
Well, if people wanted to work with you or find out about your programs, how do they connect with you, and what do you have available now?
They can go to my website, tailoredforchange.com. And right now I have the presentations that are focused like the different phases of trauma and connection between mindfulness, trust, trauma, and EMDR. Those are free. Then I have a retreat coming up on October 27th, which is like an unveiling of oneself. Everything, the snacks and supplies are going to be provided. And it's also focused on trust and being able to identify the different masks that we wear on a daily basis and how that impacts our relationships, but most importantly, how that impacts us, right? And then for the new year, I'll be doing a group. This will be the second round for it on boundaries. Boundaries
I need that.
And boundaries are for us, right? To be able to identify them. Do they support our values, and how can we honor them? And then probably after that, I'll probably do a Daring Greatly group, which is on the research of Dr. Brene Brown.
Sounds wonderful. So now I have a personal question for you.
Yes.
What gives you the most happiness and fulfillment in your life at this point?
My doggy, El Choco, also known as Chocolate, also known as Deja Eso, meaning leave that alone. Witnessing my partner, how he sees me and how he acknowledges me, it fills my heart. Witnessing my mom and how she has been able to witness my process. And throughout witnessing my process, she has also expanded her curiosities and made so many changes. And we went to a retreat about 3 or 4 weeks ago. I was like, you want to go on a retreat with me? She was like, okay, Joe boy, I'll go. She's 74. She's like, I'll go. And we went and she was like, wow, we did chakra work, did Reiki, yoga. And she's like, I feel renewed. So witnessing that and my friends when I'm geeking out about things I'm learning and them allowing me to practice on them. They be down for what I'm like, listen, I learned this new thing. I want to try first.
Uh-huh.
Come to my house. And they're like, oh, we're always Nancy's guinea pigs. I got to do it. Yes. So they come and so being able to witness them experience what I'm learning and what I'm curious about, and them seeing me as a person and as a loved one, it brings me joy.
It's beautiful. Well, thank you so much for being on the podcast and for all your
Thank you
wisdom
for
and
having me.
stories.
Yes.
So I have
Thank you
one last
for having
question
me.
before we complete. What is your best advice on living an incredible, amazing life?
Learning to trust yourself and learning to challenge what is coming at you, right? And that can be from whatever the standard is supposed to be. Being able to learn how to challenge that you have the right to challenge that because you have the right to experience your emotions. You have the right to identify what your true values are, not what you've been told they're supposed to be. You have the right to choose your beliefs as to what is authentically yours now, not what you've been told, right? And that also allows you to not try to fit in. We just want to be part of and we want to be able to receive love and affection, and we are worthy of it. So I feel that that starts from trust, it starts from self-compassion and allowing yourself to be open to you first and your experience as a human. And then it can expand from there.
Beautiful. Thank you so much.
Thank you for having me.
We'll talk to you again soon.
Yes.